My name is Saul Pressner, and I'm the president of the Academy of Biomimetic Dentistry.
I'm Dr. Tracy Dennis-Tuari, and I'm a clinical psychologist, but I've been a researcher for the past 20 years.
And welcome to our little webinar here on stress management for the dental professional and for patients.
So I think we were going to begin by maybe briefly discussing first what is stress, because it's a word that's sort of on all of our lips. It's a placeholder for every uncomfortable feeling. But stress is not an emotion. Stress is a calculation. Stress often feels bad, but stress isn't only referring to bad events. We can be stressed about, some event we're very excited about and anticipating with a lot of joy. So when we talk about stress, it is important to know that there are all sorts of feelings that can live under that umbrella.
How to de-escalate situations to cause less anxiety for the patient and for ourselves as practitioners.
So once you have an angry patient, it's going to be hard. You can't, as healthcare providers, predict everything that's going to happen. But yet, you have to act as if you can, because you have to reassure your patients.
As dentists, we're trained in excellence in terms of doing a certain procedure perfectly, which is not the real world. If something doesn't work, and if a patient expresses anger to us, we're really not prepared for that.
Do you think this engendered, a sense of failure?
Yes, totally. One scenario that came up a lot of times during the pandemic, especially before vaccinations were available, when we didn't really know much about COVID, was prioritizing a dental issue for a patient versus the risk to the staff. And that was a source, I think, of anxiety for the dentist as well as for our staff members.
It seems to me that in these kinds of decisions, dentists are sometimes maybe feel very alone.
Totally isolated, absolutely.
Isolated. Yeah. And yes, something bad could happen, but anxiety is actually helping us persist in doing the right thing and taking care of ourselves and making better health choices.